relationship-based care is perhaps being seen as something innovative and new, but really we're cutting to the very core of care and primary care in Wales. I think it's very good that it's been brought together in this way, and that there's a focus on what it is we mean by basing care on good relationships between a doctor and their patient. I think there's been a real strain, and it's very clear to us as constituency members, regional members in the Senedd, a real strain in the relationship between patients and the health service over the past 2.5 years. We haven't experienced anything like this before, and I think we're still trying to find our feet in resuming that kind of relationship that we need to have, the positive relationship between healthcare and the patient. People still tell me, why aren't GPs seeing patients? And I tell them, GPs never stopped seeing patients through the whole of COVID, but there's still a perception out there that somehow the relationship has gone almost, and it's clearly not the case. Coupled with the fact that face-to-face meetings were more difficult, which they clearly were, and innovative ways of delivering healthcare had to be found, coupled with the sheer pressure on primary care and the lack of capacity to respond to that pressure, we do face very real challenges. But I think in this report, we really look at the fundamentals, the need to make sure that relationship-based care is built in right from the very start in the medical schools, so that this is something, the importance of that relationship and the value in healthcare terms of that relationship is understood right from the medical school. That those medical schools produce enough GPs coming through to the system, because it's very difficult to have meaningful relationship-based care if you're stretched to the limit and don't have the capacity in terms of doctors. It's important to make sure that the resource is there. Resource, be it, as this report highlights, IT and so on, to make sure that the systems are there to allow the GP to concentrate on that relationship. But also the time is there also, staff time for patient care. So on so many levels, we're looking at something that is well-timed, coming out of COVID, building that relationship, changing the understanding of the patient in what primary care is and what it does. People often tell me, I can't get to see a doctor, and I explain to them, why do you need to see a doctor? You might not need to. The doctors need to be able to concentrate on the people that need to see a doctor. And it's changing that cultural attitude between patients and primary care, again, that will allow the GP to develop the concept of relationship-based care. So I think this is a well put together report that hopefully government is hearing, is taking on board, and will help you, because that's what we're talking here, to make sure that you are able to give the best possible care to your patients. So diolch yn fawr iawn am gael fod yma efo chi heddiw yma, a dymuniadau gorau chi. Best wishes to you with the rest of this lunchtime event. Diolch yn fawr iawn.